Let me go ahead and call this meeting to order. Welcome all of you to the Commission on End Homelessness meeting, and let me ask our Commissioner, Nelson.
Hand over heart. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner. And I'll just share a little news about Commissioner Bruno Nelson. Just received her master's degree, so let's give her all a big round. Doctorate degree. Even more. That should have been a louder applause. In any event, thank you all for joining us here today. The agenda for today is going to contain a brief description of each item to be considered, except as provided by law. No action shall be taken on any item not appearing on the agenda. The Commission to End Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during general public comments, please complete a speaker request form and turn it into the clerk. Prior to the reading of the item, speakers will be given 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comment may be submitted electronically by emailing response@ocgov.com. With that, we will move on to roll call.
Thank you. Please indicate your presence when I call your name. Commissioner Sarmiento?
Here.
Commissioner Wagner? Commissioner Vanderpool?
Here.
Commissioner Kim? Here. Commissioner Rose? Here. Commissioner Parks?
here.
Commissioner Hawley?
Here.
Commissioner Dimitropoulos?
Here.
Commissioner Hurst?
Here.
Commissioner Twan? Commissioner Davis? Commissioner Ivins?
Here.
Commissioner Spitzer?
Here.
Commissioner Cunningham? Commissioner Afable?
Here.
Commissioner Wyatt?
Here.
Commissioner Peineman? Commissioner Bruno Nelson?
Here.
Commissioner Rios Faust?
Here.
Commissioner Morse?
Here.
And Commissioner Wagner?
Here.
Thank you, and we do have quorum.
Great, thank you, Madam Clerk. Just as a housekeeping item, please be aware that the room is hot mic'd for the live streaming of the meeting. Additional microphones are placed on the table in front of you. Commissioners, please speak into the microphones so it will be picked up for your comment on the live stream. Please try to keep side conversations to a minimum as they may be picked up by microphones throughout the room. So what I did, one of the few changes I did to the agenda for today is to put the public comment at the front end of the meeting so we can go ahead and make sure we listen to those folks. They don't have to wait to the back end of the meeting. But also one of the objectives is to try to get us through with the meeting as quickly as possible. So we're going to try to run it, even though my predecessor ran it pretty efficiently, we're going to try to keep on those long coattails to do the same. So at this time, we want to take public comment from any members of the public wishing to speak on any non-agenda topics that are under the subject matter jurisdiction of the Commission. Madam Clerk, do we have any requests to speak?
We do not have any requests to speak under general public comment.
Thank you. We will now move on to the agenda for today's meeting, and we'll begin with a discussion item. So will you please read the first item?
Item 1 is the Office of Care Coordination update, which includes updates on the cold weather emergency shelter ad hoc, the tiny homes ad hoc, and the homeless prevention and stabilization pilot. We have no requests from the public to speak on this item.
I'll go ahead and turn it over to Doug so he'll provide us an update. And what we were thinking is we could maybe take a pause after each one of these sub-items that is under the discussion item category. So I'll turn it over to Doug.
Thank you, Supervisor. Good afternoon, everyone. Thank you for coming. Appreciate everyone continuing to come and having such a strong attendance each time. So for the Office of Care Coordination update today, I'm going to be providing truly an update about a couple of efforts here that are in progress. So the first one is our cold weather shelter ad hoc. I'm going to try to figure this mic out a little better. So before we get into the update on the ad hoc, I wanted to provide just a brief reminder of what this year's looked like, or this year's cold weather shelter. So in January, the Board of Supervisors entered into an MOU with the City of Anaheim to operate and provide up to 50 emergency shelter beds during the cold weather an inclement season this year. The city's cold weather shelter, emergency shelter program was activated based upon inclement or cold weather events and contracted with faith-based and community-based organizations. The city's reported that they've activated 6 times over a 12, which includes 12 night period between February 1st and March 30th. And it served 67 people experiencing homelessness. And through those 6 activations, 5 of them were due to rain, and 1 of them was due to cold weather, which was below 45 degrees. So that just provides people with a reminder of essentially what we're doing this year. As folks may remember, the commission reconvened the cold weather shelter ad hoc, and just as a little bit of context here, Supervisor Sarmiento, city managers, Vanderpool, Rose, and Kim are members of this ad hoc, and Captain Ivins and Chief Holly as well. Knowing that it takes a good amount of time to prepare and implement strategies and programming specifically around the response to the cold weather, the cold weather shelter ad hoc met on April 2nd to start the draft of their recommendations around the county's approach to cold weather in this upcoming winter. The focus of the meeting was to review communication strategies and programming of this last year and taking lessons learned to help us shape our approach and strategy for this upcoming winter. The reflections and goal, the first reflection and goal was for us to get us to start our planning process much earlier. So we feel like that's checked off the first box. Having the meeting in April and starting our meeting in early April, several months earlier than we've ever started the planning process and earlier than the previous year. During our April 2nd meeting, City Manager James Vanderpool provided us a more comprehensive overview of how things are going at the Anaheim Cold Weather Shelter, really providing lessons learned and some valuable context and information for us to reflect upon. Other members of the ad hoc group gave their thoughts and feedback on the effectiveness of last year's communication strategy, which is primarily focused on specific letters out to city mayors and managers asking about their interest in partnership and their need and approach. Our next steps from this April 2nd meeting are, I've met with each of the ad hoc members separately to ensure that we're gaining the full feedback and bring that summary back to our next and arguably final ad hoc meeting on April 30th, where our primary focus will be finalizing the recommendations that this ad hoc will bring to the commission in our June meeting. Before I move forward, I also want to provide an update and response to the director that Commissioner Spitzer provided last meeting, which was a directive to staff, our staff, to study how the county might assume costs or allow funding flexibility for cold weather shelters in order to, 1, reduce partner costs, 2, incentivize partnership, and 3, expedite annual planning. I'll start to provide a brief update on our work. I want to provide a brief update on our work in these efforts. So starting with the easiest one, expediting planning. As I mentioned before, we feel good that we've started this process here in early April. So between the ad hoc and our team working internally at the county, we feel like we're off to a good start. More importantly, reducing the cost and expediting partnership. Our office has worked internally and met and has done some research and also met with our county procurement office, our county council, our budget team, our risk management team to really explore these 2 areas. The first step we think that's impactful is to start the conversation. I'm sorry about this microphone. start the conversation and planning earlier with our cities. And I know that sort of feels redundant, but if you may remember last year, the timeline was really condensed. And when we partnered with Anaheim, one of the things we highly appreciated was that both groups were willing to sort of sprint to the finish line and make sure that we were able to make something happen. But as we reflect, and we realize that if we start that conversation off earlier with our partners, really our ability to flush through potential models and funding framework allows us to really explore much more closely that flexibility and feasibility that we're looking for. When meeting with County Council and Risk Management, our CPO team, our County Procurement team, we talked about the importance of also our strategies around solicitation for groups that were non-traditional vendors, and how do we commit to ensuring that we're flexible in those areas as well, because we know that or we believe that the cold weather shelter is one of these solicitations that might attract vendors that don't normally partner with the county or don't have as large of an infrastructure and familiarity with the county. And essentially, all groups leaned on the importance of making sure that we start this process early so that when we're flushing through these models that there's really specific, and not to get too into the weeds, but some of the challenges around insurance or liability and things to that nature. When you're going through a negotiation and a procurement process, there's certain things with each partner that they're comfortable with, and certain things that, you know, for whatever reason, their particular line of business, the way their company's structured, you know, the standard language isn't comfortable. And we at the county have made a commitment that we're going to ensure not only that we start these conversations earlier, but really with the spirit of walking through the contract also a little slower with each of our vendors, specifically those that might be non-traditional vendors, to see where there may be flexibility and ensure good partnership. With that, I'll pause.
Great, thank you for that. And so before I bring it back to the commissioners, I want to thank the ad hoc members for meeting and going over these topics. As Doug was saying, we had a really robust conversation, and thank you, Commissioner Vanderpool, for sharing your experiences in Anaheim, and thank you, Commissioner Spitzer, for giving us some suggestions. And that's kind of where I wanted to also make sure that all of you feel like you should all feel that you're able to make suggestions as to new ad hocs, as to topics on existing ad hocs, like the ones that we already stood up. But you know, feel free to go ahead and do those. We can't give direction as commissioners, but we can certainly make those suggestions to the larger commission, and I'm happy to consider those. And if there's something that maybe comes to mind after we convene, and you want to send something to me by email or a text message, happy to receive those and incorporate those. But I think on the suggestion, I think that that Commissioner Spitzer made was about having city managers at the table and making sure we get their expertise. I want to thank Commissioner Kim, who joined our cold weather shelter ad hoc, and now we have the three city managers from this commission there, and she added a lot of value, you know, from the central spa perspective, but just her experience as an existing city manager. So with that, I know that it's a work in progress. We're already entering and getting close to May, so even though we wanted to start early, time just spins by. So the sooner, you know, I'm glad we just started talking early versus, you know, waiting until summer, because we know that these items just roll right by us. So with that, let me go ahead and open it up to any of fellow commissioners if you have any questions or comments on this.
I just have a question, or I'm not sure how it's gonna. So let's talk about risk. So the entity that determines how much risk the county will assume is the Board of Supervisors. Obviously, after getting input from risk management, but I'm Mr. Chairman, my question is, as you're going through these discussions, is it possible to think about potential constraints or demands that a vendor, provider, entity may need for their own insurance or their own liability that the county and the board could consider, either through an ad hoc from the Board of Supervisors, who's also working with risk management, or you as the chairman of this committee making recommendations to your colleagues? Risk is, I just got an email on an event I'm having, and Risk is involved in this event because the host of my event is raising questions about liability. And we haven't had these problems. And we all know insurance in California is becoming a major issue for everybody. So probably issues we didn't necessarily have to think about. All of the underwriters are now thinking about major issues, and it's gonna impact all of us. So that being said, I think things are gonna happen differently on the natural in California because of underwriters and insurance companies. And certainly we're self-insured in the county, I think, for the first, depends on the incident, but the first 10 million generally. Do you have any response that might be insightful that you might share? In other words, I think that I'm asking if we could also anticipate the Board of Supervisors being able to give direction or maybe having some malleability on assuming additional risk if our vendors need support on covering something they wouldn't normally accept liability for.
So let me go ahead and ask, staff to go ahead and see if they can address that. To the first point that you made at the last meeting, how do we motivate our partners to be able to step up? And we want to make things as easy for them as possible. Like when Commissioner Vanderpool was talking to us about his experience in Anaheim, yeah, it's tricky, right? I mean, you want to encourage folks, but you don't want to lay them with a responsibility that's going to be additional burden. So if we can lighten that load, I think it's something worthy of us to look at. Maybe that's an additional item that we look into as well. That's why, one of the things that we were talking about in the ad hoc discussion was our existing network of shelters that we already have. That's something that we didn't have before. The risk issue is still present because you're lowering the barrier of people that you're going to start including when it comes to a cold weather condition. But there's already coverage and carriers in place. So it's easier to work with that network and maybe setting aside some existing beds in those communities that have those shelters. Obviously, the southern spot doesn't have as many as the central and northern, but to the extent that we now are working with a natural group of people and cities actually that have already leaned into this effort, that's something that we might want to do. But do you have anything to add on that?
So it was really helpful to meet with risk management on this, and I think our discussion, there was a reflection from risk management that to some of your points, and I think the interest is there's sort of two things that we talked about, and probably the first thing we talked about a little bit more, which was some of the standard language that might not just be applicable, removing that. That doesn't necessarily, and I can't fully or at all speak to risk management's perspective, but I imagine taking away language that's just not applicable isn't as risky as taking on the changing landscape. I think the commitment from the staff's end and specifically from risk management was the importance of sitting down with our vendors to walk through exactly what some of those unique pieces are, and then obviously from there making suggestions up to the board about willingness to be flexible.
Just a couple of comments. I think starting early was great. I'm not sure it's ever early enough because it goes quickly, right, when you're trying to deal through the issues. And I do think the comment about including the existing network and looking at that, developing as you said, there's additional the cold weather shelters in need because we have people on the street who aren't served by our current shelters and move along. So really would be helpful to consider how we would engage and get more people to use the existing shelter network so that the delta in the number would be smaller and we would be better prepared to handle them. The ideal is that we wouldn't have to go to simply cold weather only, that we would be able to handle them within our network. And so whatever those reasons are that we're not handling all of those, we need to continue to address, and that's part of this overall thing that we just can't ignore. So efforts as we work on this need to look at the shelters broadly and cold weather issues as a a smaller part of that, hopefully, so that's what I'd recommend. I do think we should also bring status back here more frequently, you know. Last year, I felt like it was November before we reached enough, and it was already cold, and that's what brought it to our attention. You know, that's only a few meetings of this commission away, so getting it back earlier and keeping us informed and where we are in leadership and where we are in progress would be really helpful.
Completely agree, and I think that one of the key questions is capacity, right? Some shelters run at higher capacity than others, so where are those, you know, placements or beds that might be more flexible when it comes to, you know, setting those aside for those cold weather incidents? Commissioner Hurst?
I'm a real fan of what the community did during this past cold weather season. It was interesting, though. I wanted to bring it to the attention of the committee that our Salvation Army team was analyzing the utilization of the flex space in Anaheim, because obviously that's where our Center of Hope is, and there's some indirect overlap in those efforts. And one thing that I thought was noteworthy was some of the people utilizing those flex shelter spaces had been exited out of our established shelters. And I thought that was a really interesting, speaking about liability, they were bringing to my attention the fact that we have 325 beds and we operate one of the lowest barrier shelters in Orange County. And quite a few of the participants in that program had been exited out of ours. That needs to be on the radar of the ad hoc committee, and part of this discussion of who's likely to be utilizing these shelters. That's going to be a very important issue. Thank you.
Thank you for that. Any additional comments from the commission on this item? Well, we will report back after the next meeting and make sure that we incorporate those questions and suggestions.
Yeah, absolutely. There we go. Second update is on the tiny homes ad hoc. So just another reminder of participation in this ad hoc, the members of the particular ad hoc. Let's see. So additionally, the ad hoc's goal is to evaluate alternative housing solutions, including studying, defining, and identifying potential applications for tiny homes. There's been a lot of progress and work in the past 2 months from our office around tiny homes. We've had communication with 6 developers of tiny homes, 5 operators as well, and several other groups interested in exploring and possibly standing up tiny home models. Our ad hoc has so far met twice. The first time was our first general meeting to help set the framework and the direction of our ad hoc, and our second meeting was our first interview with a particular developer. These next 2 months, we've lined up visits to over a half a dozen sites, and we're going to conduct several virtual interviews with providers, operators, and stakeholders who are not only interested in potentially exploring investing in tiny home ad hocs, but who have knowledge around funding, things to that nature. We believe that at our August meeting, the ad hoc will be able to provide its final report, which will include recommendations around framework for future evaluation of proposed tiny home models, potential models, best practices, challenges to consider when facing and standing up tiny homes, and then thoughts on potential applications that might be worth considering in Orange County. So, as I mentioned, we've done a lot of work these last 2 months. These next couple of weeks, specifically, the ad hoc is going to be touring a handful of sites through LA County and a couple of other locations. So we're excited about bringing back that feedback in June, and then a formal report back in our August meeting.
Any questions or comments on this item?
I have just one question.
Yes.
Is the purpose of this ad hoc or the charter to look at tiny homes or less costly homes, I guess is, so I don't know how broad its area of investigation is, I'm just.
So I think one of the primary functions of the tiny home ad hoc is help provide a more concrete framework and definition to exactly what we mean by tiny homes. In terms of the cost piece, I think there is one of the underlying purposes of exploring tiny homes is the belief and understanding that they often are more affordable and quicker to install. So knowing that those are two important factors, let's make sure, I think, that we also look into all of the other considerations that tiny homes comes with, and ensuring that that we're viewing them when tiny homes comes across our plates, that we understand exactly what our definition of tiny homes is, and also to provide a framework to the group that allows them to better assess, so that to ensure that there aren't just two questions: how cheap is it and how fast you can put it up. But there's a set of questions, knowing that that's not the only thing we look at when we think about shelter or permanent housing.
I just know that the issue we really have on providing more housing. I mean, I don't think we have any doubt here that more housing is a critical part to homelessness. And as Commissioner Spitzer brought up when we reviewed the cost of housing and what we were providing, at $700,000 a piece, we just won't get there from here. I mean, that's just not a workable number, and in some areas we've seen it higher. So the tiny homes, among others, whatever that means exactly, as you said. I mean, the overall thing, we have to find that number that we could, at a per unit cost, would actually be a sustainable model for providing homes to meet the need, the demand that we're seeing. So as we look at that, I think we need to, one, define it, and two, we need to look at all the options we have for providing housing at costs where the model could actually work and we could actually meet the demand. We need that number, and we need models that do it, and we need to see it works. I'd love to see this moving forward, just to figure out what that number would be, and then what options we have.
Yeah, great comment. So I think that's what the ad hoc was discussing as well, is that this shouldn't be abandoning development of additional housing units. This may be a piece of that continuum of housing, right? Because we all see that, there was an article that documented how many people were actually placed in housing after leaving the shelter. The number was really small relative to how many people are actually there. Shelters aren't supposed to be permanent housing. It's supposed to be, again, one step or one phase in the continuum of placing folks into permanent housing. But I do think that we're missing that link, right? Sort of the immediate placement into maybe not a brick and mortar, but a prefabricated, unit that can be stood up quickly, inexpensively, relative to what a brick and mortar traditional housing unit would be. So even motel conversions using half dollars or something, I think that the ad hoc brought up, another inexpensive way, probably more costly than the tiny homes or prefab homes, but less expensive and less lengthy in time to stand up a unit. But those are the kind of discussions I think we just need to have, and just think outside the tiny box model, outside the permanent box model.
I don't think we can express urgency enough to get answers, right? Because as you know, from that report you were talking about too, we are putting people into shelters without having any idea of how we could house them coming out of the back end of those shelters, right? And that sort of takes some pressure off, and I don't think, the one thing we as a commission should never do is take the pressure off of getting the right solution in place. So we need to continue to push for a solution that's workable.
Any additional questions or comments on this item? If not, we'll move along to the next one. Doug?
Yeah, sure. All right, lastly is just a really quick update. So, our office, there we go. Our office has issued a request for proposal for qualified organizations to operate the homeless prevention and stabilization bed pilot program. This was the program that was presented to this group by Chair Sarmiento in our December meeting. The goal is it's a prevention program to assist households who are at risk of experiencing homelessness achieve stability through financial assistance and other supportive services. The request for proposal was open from March 21st to April 11th, so it's closed almost a week ago, and we anticipate that when we meet this time in June, we'll be announcing who is the operator for that. So the RFP is closed, the procurement process on the internal side of the county is happening, and we're excited that hopefully by our next meeting, we'll have an operator.
Thank you for that update. Any questions or comments from the commission?
I'm curious, how does that decision get made?
In terms of the operator?
Yeah.
So through our traditional procurement process, so there is a panel, that reviews all applications. There's a specific scoring rubric that is created to ensure that there's objective scoring across each particular application, and the scoring panel essentially they each independently score each application and then meet as a group and ensure that there's consensus on who rates the highest as the application, and then our office will go through negotiation process with that vendor, and through that negotiation process, that's where we not only negotiate budget, but also ensure that the scope of work and the programming is exactly what we've intended, and that the selected vendor is able to commit to that.
The reason I bring it up is I think that this work in prevention of homelessness aligns so clearly with the intent of this commission that while it's a county function and I see procurement and all of that, and I agree with that, and that we need to have something that moves it along, I would suggest that it be very much tied to the work of this commission over these next 12 to 18 months so that we can align with this very closely. It's one of our 4 pillars in prevention, and I think we need to stay very close to it.
Yeah, thanks for that comment, Commissioner. Just because in my opinion, that concept or that proposal was really sort of born here from the discussions that we were having, talking about the back end. The front end, if we can kind of flatten that number or keep it, somewhat, manageable on the preemptive side, that's really, part of the goal of the program. Much easier to keep folks housed, less expensive on the front end than on the back end. So that certainly is something that, and I even think as part of the proposal, we had a quarterly update to this commission. So each time we meet, again, this is the update that we're going to have on it now, letting you know that the procurement window closed, and so we'll, once a vendor is selected, we'll bring it back to this commission as well for continuing comments, and it is sort of a malleable, work in progress. So, all your comments are going to be very well received. Commissioner Spitzer.
I just have a clarification, Doug. You said something, I just want to make sure, since this is a pilot, and I want to make sure we get this right. You said after scoring, then there's like a collective meeting of the minds. I'm not sure in procurement if you can do that technically.
What I
You
meant
want to
was-
clarify what you meant by that?
Yeah, what I meant was that I believe what you're referencing, that meeting of the minds, that's not a meeting of the minds, that's a meeting of the evaluation panel.
Right, but let's say you have your scoring sheets. Are you saying before those are published individually that you are comparing scoring together collectively?
No, all I'm saying is that evaluation panel gets together, and that's where the top vendor comes out from,
is from those scores. So-
Okay, but to clarify, and I don't mean to be nitpicky,
No,
but
no,
I am
I
a little
appreciate
bit, because I don't wanna mess this up,
Yeah,
right?
yep, absolutely,
You all are doing your individual scores.
absolutely,
Those are all sacred
yes.
entity.
Mhm,
And then at some point, those get published and you can see where people
mhm.
come out in the scoring,
Yes.
right? You're not having a meeting of the minds during the scoring process.
Yeah, we're not going and saying, hey, yeah, no. The answer is no.
Okay.
Thank you, I
Thank you
appreciate
for
that.
clarifying.
Yeah, just for further clarity, that's a good question. Our office doesn't, or any of the offices, don't really involve themselves in the process just to make sure the integrity is sacred and is protected. But to the extent that we want to hopefully introduce the vendor once the panel has selected it based upon the scoring, it'd be great to bring them back. Hopefully they can present and provide us information going forward. So we'll make sure we do that. Thank you for those questions.
Can I just also clarify, we follow the county procurement manual very closely. I'm clearly not the best spokesman for that, but, and I know for the CPO crew that's either here or listening, they're sweating bullets, to say the very least. But they hold us to a very, very strict process and standard, so I appreciate the ability to clarify on that.
Thanks for that. All right, Madam Clerk, will you please read the next item?
Item 2 is a presentation titled Proposition 1 Implementation Behavioral Health System Modernization Summary, presented by Dr. Veronica Kelly, Director for the Orange County Healthcare Agency. And we have no request from the public to speak on this item.
Thank you, Madam Clerk. So as we all know, Prop 1, the Behavioral Health Services Program and Bond Measure, was approved by the California voters during the March 5th election. Prop 1 is comprised of two major components related to providing mental health care and drug or alcohol treatment to people and addressing homelessness. The first component is a change to the MHSA with a focus on how money from the Act can be used. And the second component approved a $6.4 billion bond to build more places for mental health care and drug or alcohol treatment, and also more housing for people with mental health, drug, or alcohol challenges. The presentation is really to explain to us and bring back to us what those impacts are, what those changes are. I think, we've exhausted ourselves in saying how painful this was because we were one of the counties that were good actors in this space, and I think that we've demonstrated results. Even I guess Mayor Steinberg, who's really Senate Pro Tem when a lot of this happened, wrote an op-ed and called out Orange County as a very good actor in complying and using good fiduciary responsibility, but just being effective with those dollars. So unfortunately, we were doing the right thing and being a good example, but because the voters decided otherwise, they went ahead and sort of modified the use of these dollars. That being said, we're all kind of disappointed because it takes monies away from, we think, good programs and projects that we've been working on. But nonetheless, we need to turn the page and see how we can use this to our advantage and make sure that we're competitive with these dollars, that we have a plan going forward. So with that, I'm going to go ahead and turn it over to Dr. Kelly so she can make this presentation.
Thank you. So, thank you very much. So, as the chairman said, Prop 1 was approved by voters. I think that going into this, we've known about Prop 1 and these assembly bills for about a year and a half. And we in County Behavioral Health have been really trying to get behind this, negotiate with the governor's office. We were able to get some things from the governor's office for every county in the state, but it wasn't quite enough. So the whole idea here is to switch funding around a little bit, reimagine what the Mental Health Services Act could be adding to it, substance use disorder as part of what can be served, and to build 11,150 new treatment beds. Initially that was in-community voluntary beds and became later locked facility beds, which adds a different dimension to things. Getting something like that cited is really, really difficult. It has 4 parts to it. Really, the governor's office is saying that this is really so we can provide services to the people who are in most need, to ensure that counties are accountable, to create behavioral health housing so that we can pull folks off of waiting lists, we can pull them out if they're in need of treatment We can pull them off so that folks who don't have a behavioral health issue can utilize the inventory that's available, and then to build up our workforce. So this was certified. It says here it wasn't, because when we wrote this, it wasn't. So what we're trying to do is prepare for what our next steps are. So just to show you, the graph on the left-hand side in the purples shows that the way our money came in, we had about 3 buckets. Really, there were 5 buckets, but the bulk of our funding were in these 3. So community services and supports was the biggest bulk of it, 76%, 19% was in prevention, 5% was in innovations, and then we had money in workforce education and training, and then capital and facilities. We had anticipated receiving $328 million. That was our budget for the next 3 years, $328 million. Due to the volatility of these funds, because these funds are from millionaires. Millionaires play their dollars a little bit differently than some of us in this room. Because the funds are sometimes not taken, they're in stocks and bonds, they're not drawn out, there's no taxes paid, we don't really know how much we're gonna get. But we are anticipating getting $173 million. Our budget, over $300 million, we're gonna get $173 million. We budget for a 3-year plan, so we're gonna be in trouble. About $200 million of programs that we currently have operating, we're gonna have to switch. Not only are the funds coming in differently, but we can't use them in the same way. And so the funding buckets shift to 30% for housing interventions, 35% for full service partnerships, and 35% for everything else. 30% for housing interventions, this is for people who have a serious mental illness, people that the county would normally serve. This is not for someone who has a mild depression or even a moderate bipolar disorder. Those folks are served by CalOptima, and CalOptima has funding for housing. Very specific to BHSA, Behavioral Health Services Act, which is what Prop 1 is now. If CalOptima or Kaiser, our managed care plans, can pay for something using their Medi-Cal dollars, we can't use these funds to pay for similar things. So that's a difficulty as well. So 30% is for housing interventions for people who have serious mental illness, or they have a substance use disorder, a diagnosis of a substance use disorder. Not just that they're using, they have to have the diagnosis. And they are either at risk of experiencing homelessness, they are homeless, or they are experiencing chronic homelessness. From that bucket of money, that 30% of what we're going to be getting, at least 50% has to be geared toward someone with a serious mental illness or a substance use disorder who is chronically homeless. That can include rental subsidies, operating subsidies, shared housing, and other housing supports. Capital development can be used for 25% of that 30%. It has to be built within a reasonable time frame as determined by the state, and the state has to approve our plan. That is a little bit different than what we currently do. The state doesn't approve our housing plan for MHSA dollars. We do, it's a local decision. The second bucket is 35% for a full service partnership. That is one of the administration's favored programs. It is wrapping a person with all the services they can need, including transportation, taking them to and from services. It includes housing for someone who has a serious mental illness, and 24-hour care. They have a case manager who's attached to them who can respond to them in the field at any time that they need the service. And so this is a requirement for us. Orange County overdoes full service partnerships. So what's going to end up happening for us is we have to cut these current full service partnerships by about $35 million. We're trying to offset that by trying to figure out how we can combine some of our FSPs, our full service partnerships, so we don't end up cutting, but that's a difficulty. And as Supervisor Sarmiento, or Commissioner Sarmiento, Chairman Sarmiento, all those things said, Orange County is one of the few counties who has consistently met the requirements of MHSA. We've been called out by one of the authors of the Mental Health Services Act and a big proponent of addressing homelessness throughout the state. And that's Mayor Steinberg, and he acknowledged the great work that this county has been doing. Yet at the end of the day, we ask for an off-ramp. Since we're doing such a good job, can't we get a special consideration? Give us a metric we must hit so we can get this special consideration, so we can continue doing great work. And what we were told is, yeah, but you're one of 58 counties, so no, we can't have that. They did keep the door open for us, so we are gonna continue to negotiate with them on this one in particular. And then the last bucket is for everything else. That includes everything we do to keep people with a serious mental illness from being unhoused. All of the prevention services that we do that's part of your pillars, that are part of our pillars, we will no longer be able to do. That's just part of this. We are able to move up 7% between at least two buckets. We can't go over 14% between these buckets. And what our plan is to move 7% from bucket 1 into bucket 3. What we're gonna have to do is add about $27 million to bucket, the 30% to bucket 1. But for the bottom bucket, we're gonna have to cut $150 million in programming. Again, those are services your constituents are currently receiving. We're gonna cut from that bucket. So we're trying to put as much behind that bucket as we can. So the bond measure gives $2 billion. The programs will be administered through 2 different agencies, the State Housing Community Development Office and CalVet, the Department of Veterans Affairs. They each get about $1 billion each, and these are for people experiencing homelessness who have these same behavioral health conditions. For us, this is a difficulty because currently we give, this last fiscal year, we gave $26 million of Mental Health Services Act dollars over to our partners in OCCR so that they could build housing. We will be capped at $9 million a year to do that. For this last 3-year spending, $40 million is what we're gonna move. We won't be able to move $40 million. We would only be able to move $9 million a year into housing. That's an impact. In order to do all of this, we have to have a community planning process. So the Behavioral Health Services Act and the Mental Health Services Act before, we have to hold pretty robust community planning. The community tells us what things are needed. We have to look and see if it meets requirements. We have a plan, it's out for public comment, and then it gets approved by the board. We're expanding the requirements for this. We have to add again other aspects, and the state also said, well, since we're doing all this restructuring, let's put every behavioral health funding into the same plan. So it's taken a lot of different processes that have nothing to do with the millionaire's tax and added them into the millionaire's tax, which adds a lot of things administratively on the county side. So you will see a lot of advertisements to come out and talk to us about our services. Please participate in those. We can't make any big changes unless the community has weighed in. So it's important that we have folks participating in this. These plans have to be approved. Your plans have to be approved by our board of supervisors, and that's the way it's always been. This is just a picture to show you the chaos we're engaged in all the time, which just shows you how our community planning process goes, but you have slides so you can look at those in your leisure. There's really been a focus on accountability at the administration level, which really is putting the onus perhaps for people being unhoused on a lot of different entities, including behavioral health. My argument has always been that blaming behavioral health for mental illness and for homelessness is like blaming oncology for cancer. There's no connection. In fact, what we are doing is preventing people from falling into homelessness. We serve over 40,000 people, unduplicated people, a year in the specialty side and in our side. That's in addition to what CalOptima and Kaiser are serving. And we are keeping those people, for the most part, out of being homeless. When you change our funding stream and the requirements, we are going to see a risk of increased homelessness. Not right away, but I suspect that we will see that increase. So the state is going to really hold us accountable. I will say that we are probably one of the most overly monitored areas in California. The state might as well be in the same house as we are because they are with us at all times. So this is the preliminary impact. If we're looking at each of the different buckets, You see the projected allocation we have, 52.2 million for housing interventions, 60 for full service partnerships, 60 for behavioral health services and support, for a total of our allocation we're projecting of 173. The second column shows you what our budget is in our current Board of Supervisors approved plan. And so the right is the difference. And so you see we have to cut 164 million. That's with Behavioral Health Services Act. We're gonna have to, we are actually experiencing this right now because the millionaires are not doing what they need to do for the residents of behavioral health who are being served. So we are already cutting services. We are already reducing because we have no other funds to do services with. This again is just an impact when we, it's basically the same thing. If we shift and add the different buckets, we're just taking 7% from housing, dropping it into behavioral health services and supports. This just shifts the individual buckets just a little bit. So what we've done is we've looked at all 53 programs that we fund in the county with Mental Health Services Act dollars. And we've done a mitigation plan that's been going on for the past year and a half. We've looked at each of those programs and we've determined how many people they actually serve. We've looked at performance outcome measures. Are they meeting the requirements of the funding? Each of the different buckets has different requirements, and then the county puts on additional requirements. Are they meeting those? Can these programs continue under the Behavioral Health Services Act? Are these programs drawing down federal financial participation? Are we drawing down a federal dollar so we can extend the amount of services we provide? We did that using an evaluation tool. We then put that into a decision matrix, and we used 2 fiscal modeling tools to determine what stays and what has to go. We presented that to our Board of Supervisors so that they're aware of where we're going and have their approval. Certainly our CEO and our CFO have weighed in on this. And so now we were actually just waiting for this to pass. So over the next 2 years, we will be making some significant changes, and some of those changes are starting now. We will not be extending, if a contract comes up next year, usually be a 3-year contract, maybe with 2 optional 1-year amendments, and it's slated to be cut. We won't do a procurement for it. We've been speaking to our contract providers for the past year and a half so that they know. We've also been working with all of their provider associations. They know. We've all been working behind the scenes as well. So our last conversation with our contract providers, and behavioral health has about 200 contracts. We meet with them as a group, and we've advised them that we'll be meeting with them individually to go over what their program will look like as we move into the next 2 years. We will be seeing a very different system of care. So those are our next steps. I would also like to note that because the administration put into this Behavioral Health Services Act all of our other funding streams for behavioral health services, what we're going to be looking at is how do we level our current system for behavioral health, and how do we build something that will actually work for the people that we serve, taking in consideration what people on the ground delivering service tell us, what the people who receive the service tell us, and keeping in line with rules and regulations. The system we currently have is oftentimes, I would refer to it as the Winchester Mystery House, if you've ever been there. It's a wackadoo kind of facility where there's rooms built that have no doors or windows and hallways that lead to nowhere. And in some sense, I think our behavioral health system in the state is sort of like that. Well-meaning people and legislators say, we have these monies, we want you to create this system, without actually talking to the people who receive the services or do the services. So it doesn't make sense, but we have to take the money because we have to do the service. So we end up with an odd system that doesn't work as effectively as it could. So in the coming, while we're doing this shift from Mental Health Services Act to Behavioral Health Services Act, we're also going to be asking for community feedback on what could make our system work better. Obviously, it has to work within the confines of rules and regulations, but we have to do differently because what worked in 1978 is not necessarily going to be effective in 2024. So I think it's a time for us all to come together and again, try and do anything that we can do to prevent people from falling into a place where you're going to be speaking about them because they're unhoused. So I'm happy to answer any questions if there's time for that. Thank you.
Great, thank you for that presentation, Dr. Kelly. So it's one of those brace yourselves moments, you know, where we are gonna have to have those conversations with their service providers, but then they will have to be having those conversations with families about services. It's gonna be really have a tough time on these programs are gonna be dismantled in one way for them. So we just wanted to make sure that this commission was briefed on this issue. So to the extent that we all understand the dynamics of what's happening, services and programs that we've relied on now for years, it's a way for us to pivot. And again, maybe what we do, Dr. Kelly, in the future is come back and we look at how we can pivot and start using some of these resources. In any event, I just wanted to bring it back to the here. So, any questions, comments, or discussion on that?
Mr. Chairman. Dr. Kelly, do you have any estimate on a high and low on the number of people who would end up becoming homelessness because of these shortfalls?
No, I just know that these are, folks who have a serious mental illness and or a serious substance use disorder at really high risk. The folks we serve are folks who live in poverty. So we're serving the Medi-Cal beneficiary and people who have no insurance, that's who we serve. So you could say all of those folks. I think it's that precarious in some of, in our space because we've lost treatment housing as well.
And is there any way we could provide better mental health to Sacramento?
I wish. They'd have to be willing to accept it.
Sign me up for that one.
I've got a couple questions. Over the years, Buena Park and then now in Anaheim, we receive funding at the local level from various buckets. I don't know what buckets those are, but the county's been a partner with local agencies. In my experience in both cities, how does that change in terms of direct assistance to local agencies as a result of this, one? And then two, any update on HAP funding through the state budget?
So I don't have the HAP information, we talked about that. I think the contracts we have are not, I don't think any of our contracts are with direct cities. We are though contracting with providers in your cities who are certainly serving your city's population. That's where it's gonna be. And so you'll hear, I'm sure, from your constituents in your cities who are being impacted by this.
In terms of HAP, so as you may know in the governor's draft budget, there was not a round 6 announced, but there was specific language saying that they would revisit and felt like this was a priority. It's not really an update. I think what we're looking at is the May revise to see if there's any additional guidance coming out. We expect that to come out May 14th. Yeah.
Commissioner Hurst.
Dr. Kelly, thank you for your tremendous work in our community. Many of us receive briefings from the governor's team on support for Prop 1. Can you help me and this committee understand what they thought they were trying to accomplish in a sentence or two with this dramatic change? I'm trying to just ferret through what they think they're getting done here. Because talking to them, they think they're bringing tremendous new homeless, mental health, and substance use disorder resources online.
So I'm at working on the clock, so I think it's important to know that adding a service delivery component like substance use disorder without actually adding more funding is already a problem, which is what has happened. I think not every county is utilizing their funds as swiftly as they can. Remember, we have 3 years to spend our dollars. We come in every year. We are always at risk of reversion, of sending the monies back to the state, which Orange County has never done. And we in Orange County use all of our money. We use 75% of our 3 years in the first year, and then remaining 25 in the second year. So we are overdoing it a little bit here because we've developed a really great collaborative process for getting services out. Not every county does that, and there are counties, big dog right near us who sits on a lot of money, which is very difficult to look at, I think, from the administration's perspective. But I think that the administration is looking at solving one problem and the counties are looking at solving a different one.
Thank you.
Can I just dovetail on that quickly? Dr. Kelly, sorry. Can you tell us what you need from us to support you? You've done some extremely heavy lifting with the Board of Supervisors in anticipation. It was such a close vote. Obviously, the public showed some great reluctance, but just the vote alone should telegraph that there's not necessarily overwhelming public support for a difference in approach. But as we know, majority wins, so we have to live with it, right? So it is what it is, and my question is, what can we do to support you now going forward? Like, what do you need from us in the community?
Commissioner Spitzer, I think being aware that this is happening, that there are losers in this, there just are, and unfortunately the people that we serve, there are gonna be losers. There is no more money, we don't have anything that we can replace this with. We're not allowed to utilize these funds in the ways we have in the past. So just being aware of that when you hear constituents complain to you, and we've already spoke with our honorable board about this, because constituents will call them. Their businesses are reliant upon this funding, and they're serving people. But that's gonna change because the voters, said what they said. I think participating in our community planning process will be essential. We need everyone's voice at the table, because if you, again, you're not at the table, you're on the menu. We can't speak for everybody. We're not allowed to speak for everybody. We need all of your constituents to come to our community planning events and tell us what you're wanting in a behavioral health system, and then we will ferret it out from there.
Just because of the lane I'm in on the criminal justice reform, I'm a big believer in incentivizing people to take responsibility for their criminal conduct, but I'm very supportive of diversion where appropriate and other programs like OC Cares. How can you just at least tell us what potential setbacks we're gonna have in the criminal justice lane the state's invested tremendously in criminal justice reform. I'm not happy with all of it, but it is what it is, and we're being a team player. What are we gonna see there? I mean, I've even said publicly I'm willing to dismiss charges if somebody gets drug treatment. I'm willing to dismiss charges if they get into a shelter. Like, I'm really trying to help participate in incentivizing human behavior. But what is this gonna do to criminal justice reform?
So anything that's prevention, that's funded through prevention dollars, we can't do prevention anymore. We can do early intervention once a person has a diagnosis in the first 5 years of diagnosis, but not prevention. So the programs we have in schools, the gang prevention programs, those all go. We can't fund those anymore. So that will have some impact. Our other programs, another program that's really big in OC Cares is our Project Kinship program. That's funded through MHSA prevention dollars. Our outreach and engagement that reaches out to unhoused people, that's funded through prevention dollars. We can keep some of those because we're gonna do things a little bit differently. We're trying to do a little smoke and mirrors ourselves. But at the end of the day, because we have to shift all of our other funding, that will absolutely have an impact on the criminal justice side. If you don't have funding for it, if probation doesn't have funding for it, we don't have the funding for it. Because again, we're gonna have to use our funding very specifically for the way it was written in statute for us to use it.
So for example, Project Kinship, the board took a leadership role in ensuring that Project Kinship is picking up people at all times of the day or night leaving Orange County Jail. So they don't go out immediately and reuse or become homeless, right? Like, we were all committed to that. And that was a big accomplishment to get 24-hour handoff after the release from Orange County Jail. Is that what you're saying, that goes away?
What I'm saying is the funding for that from Behavioral Health Services Act won't be there, but I know our board is committed and the CEO is committed that they'll utilize other funding. We're gonna flip funding around. We're not gonna be able to save all of our programs. I know that program, focus of OC Cares, is something that I believe will continue. And I won't get too specific about all of our other programs because the providers we haven't met with them all yet, so.
Wow. That's a heavy lift from the board about how you're all gonna deal with this. I mean, the burden's gonna be on your shoulders, right? You're gonna have a lot of very upset people. I don't know I'm glad I'm not in your position anymore. This is a real big one.
Thanks for that. Commissioner White, the commissioner.
So just a couple things, I guess, piggybacking on Commissioner Applebull's comment, prevention is a big priority of this committee, and we think it needs to continue to be a priority, so it's worrisome to see that they're taking that out as a fundamental thing. I would sort of push the opposite way of a choice. But Dr. Kelly, you said that, we have the Winchester Mystery House because we get things down in ways and we tack a room on the side because, that's where the funding is. But how do we, take and step back to say, as we make these changes, we're going to need to re-architect. We need to get rid of the Winchester Mystery House. It comes that way, but it has waste built in it, right? Because it's not an effective place. But as we reduce and we prioritize, we're also going to need to look back and say, what does that big picture look like? What does that total architecture look like, and where do these fit? And where do we move dollars to effectively build the total solution as opposed to tacking rooms on? Where's the organization? Where's the process to step back and look at that big picture? How do we get involved or get the community to have a better understanding of it? How will that happen, I guess?
Thank you, Commissioner Wyatt. I think we're going to be sending information out. We will certainly send it out to all of you to gather everyone. We'll facilitate the process because we know the regulations and we're the ones who are responsible for the public side. And so we will be bringing that to our community in Orange County as a whole. I think it's important to not let a good crisis go to waste. And so this is a crisis. So we have some cover now. We need to change our system and make it more effective. Will everyone win? No. This is not a time that, hospital association shows up and says, okay, no one come to our EDs. We're not going to be able to do that sort of thing, but we have to work with our hospitals. We have to be better partners on our side as well. So it's just a time, now we have a chance to change up our system. And we've all been complaining about the system being broken. So yeah, now we're gonna fix it. If you don't come, then we don't wanna listen, we don't wanna hear you complain about it. I'm not saying that you specifically, sir, but for everybody, we need everyone who is interested in this, in any kind of behavioral health, which of course would include unhoused people. You must come to the table.
Revising a system by reduced funds is a difficult thing, but I guess we'll have to do it, right?
Commissioner Wagner?
Well, two things, and I wanted to start off in response to Commissioner Spitzer. You're absolutely right. This is going to come ultimately to the board that it's not our privilege to sit on to make decisions. But the truth is, you saw the red numbers. There's $164 million that was there that won't be there, and at the end of the day, we can't. What are you going to do? Where are you going to get it from? Well, we're not going to get it from anywhere. We're just going to have to cut. And as painful as it is, and as much pressure as we're gonna get, it's gonna be like, I can't put in $164 million. So take it up with the governor, take it up with the people who voted for it. Which raises, in my mind, the next question. All right, so there's a slide about accountability, and that's, we're supposed to take accountability. When this fails to fix things statewide, as I think we assume it will, what are the measures for accountability? What are we gonna point to and say, this failed and we need to do something different to fix it? Help me with that accountability.
I think we are looking for cleanup language, some bills that will help us craft some of this. Again, we've had some assurances from the governor's office that we can sit and talk about some of these things, but I think that to your point, Chairman, Commissioner Widener, our outcomes, we keep outcomes. We know how many people we serve. We know how many people, we know what our point, we'll know what our point in time count looks like. We will know all of that. And that will be information I think that you all are gonna have to share. We have requirements to report up to the state. I think very clearly they will see in a few years that this is not what they intended it to be, that there are unintended consequences.
Well, let me ask this, I mean, specifically, what is the metric that would get somebody in the legislature to say, oh my gosh, we need cleanup language here? Is it a 10% increase in homeless? Is it a 25% increase in mental illnesses on the street? What? I don't have any idea what it is. What are the metrics? And the second question is, and you hinted at this, you said, look, this is not aimed at Orange County. Maybe the unwillingness to give us a bigger carve out than we got is aimed at Orange County, but really it's folks hoarding money. It's a county to our north, it might be others. Is it possible that this accomplishes, with respect to those counties, what they're trying to accomplish, and we're just caught in a crossfire?
It might, in meeting with all of our colleagues from the other counties, very few, many of our smaller counties, there's 32 or so small counties, this is the bulk of their behavioral health dollars is the HSA. They can't use 30% of their housing in Nevada County to build. There's no place to build, there's no unhoused people. There's unhoused people, but not that much, right? So it's not apples and oranges. So our associations are working, County Behavioral Health Directors Association is working with CSAC on some of these metrics and they're very focused on point in time count. But I think if you're thinking we have to build 11,000 new beds, that good luck to us. I don't know where those 11,000 locked beds are ever going to be sited in the state of California. And in addition to that, we're not just building them, but we have to license them and we have to have a workforce to work in them. And that's what was kicked. We'll see in the May revised, right? We'll see what happens with workforce, but it's dominoes, kind that are lined up. If you pull one, they all fall down. So I think that's where we are, but I 100% agree.
Commissioner Bruno.
Thank you, Dr. Kelly, for your presentation. I learned something new every time you present this. So I just want to make sure that I think I heard you correctly, because I love the question from Commissioner Wagner about how it was determined which county took cuts and which county didn't. Did our point in time count play a role in the amount of money that was reduced from the county, or is that arbitrary in the calculation?
Yeah, no, I think that was it was Mayor Steinberg who wrote an op-ed and he made the connection between where our point in time count numbers were and how we're spending our money, making a connection between that and full service partnerships. Is that a true connection? I would say no. Did we try and utilize that to get something for our county? Absolutely we did.
From the Office of Care Coordination perspective, or from my seat where I'm focused around specifically addressing homelessness and thinking about this commission, I think there's a couple of things, and some of it answers Chairman Wagner's question. One is our county, as Dr. Kelly has mentioned, has continually put significant MHSA investments into permanent supportive housing. And that number is going to decrease significantly. The amount of funding and obviously the units that come out of that. And I think that is a very specific telltale of where there will be negative impacts. I think another challenge that me and Dr. Kelly have talked about a lot, and this sort of also carries over to the CARE Act, is that the CARE Act and Prop 1 has often publicly been referenced as a direct intervention to address homelessness. But as you can see through Dr. Kelly's presentation, it's about behavioral health, as it should be, because, and we do know that folks experiencing homelessness, a large majority of them are experiencing behavioral health issues. But it's an indirect connection, and it's not a direct approach. And then the other way that our system is going to be impacted is whenever there's a reduction somewhere else, either you eliminate it or funding comes from other buckets. So, for example, HAP being, one of the grants that comes down from the state that provides us with significant flexibility that's critical in helping us fund our infrastructure and a lot of really fundamental programs. It, at the moment, does not fund outreach and engagement, which is, as all of you know, is our county outreach arm out onto the streets. If MHSA dollars are either unable to, or BHSA dollars are unable to, or being reduced, now all of the sudden funding that would go to, other critical areas of our homeless service system, we have to now consider, okay, is O&E a part of that? And then you add on top of that we all know that shelters, which are so critical to our, approach, is becoming more and more expensive to operate. So, take away all of the things that were just mentioned, the impacts that this might have on our system. Just standing alone, I'm nervous about our ability to fund and maintain our current threshold of services and housing. So now add on additional factors where, there's not an additional round of HAP. Prop 1 is impacting our ability not only to create permanent supportive housing, which we know is, so incredibly important to this particular group that it's trying to serve, those with mental illness and substance use, and then the impact it'll have on our outreach arm. So, I could go on for a lot longer, but, you can see where the indirect, the impact that it has over at the healthcare agency on their day-to-day work, but then the ripple, and I mean strong ripple effects it has through our homeless service system and other systems. We really appreciate that Dr. Kelly came and, gave this presentation.
Commissioner Rios-Vaz.
Thank you for the presentation, very insightful and educational, although not a very happy subject. But one of the, echoing what Doug said, I think this would be an important presentation or information for the COC, particularly as we look at funding that's coming through from both HUD and as we look at HAP applications. I think this is useful. And then it would be helpful if you had a timeline to get a sense of how, just in preparation for participating and engaging. And I know when Cal Optimo is doing their assessment, it needs assessment and running through all of the things that they were going to be able to put into place. It was a really useful process to get as many providers in the room to understand how to put pieces together to maximize spending. So thank you.
And similar to what Callo does with their timeline, we have one, I just didn't bring it. But we have that, and we could certainly share that. I'm happy to share this information and provide an update to everyone here.
So next week, we're turning in 900,000 signatures to change Prop 47 back in some significant ways. The thing I would beg in the context of this discussion on public policy is that we decide how we're gonna document this, because when you tell the story, right, if it's working or not working, if we're all self-interested parties, the legislature doesn't listen to us, right? And so it's your professional group, like we have, well, not me anymore, CSAC, I have CDAA, California District Attorney Association, they have California Association of Counties, you have your behavioral health. What are they doing to document this? Are they hiring a third-party observer? If you don't do this now and collect your data now and have somebody else tell your story, it is very hard to win the day.
So the County Behavioral Health Directors Association is an affiliate of CSAC. So we're working with CSAC, but to your point, we've been gathering information right now, actually over the last 6 months. And in Orange County alone, the cost just for the administration that we won't be paid for, the increased administration cost for this BHSA is $90 million. That's just the administration, just what we have to do, we have to eat that cost. So we are documenting that, and we are having some discussions with the Department of Healthcare Services on how we can come together with some possibilities for legislation to move to do some cleanup language. But But they are, and the county does, we're keeping information ourselves.
Commissioner Fowler?
Thank you, and Dr. Kelly, thank you for the information. Working very closely with Dr. Kelly on many of these issues. As you know, and will recall, I'm the behavioral health, mental health representative on this commission. An observation, which is that while the healthcare agency, CalOptima, and many others have been functioning in providing mental health and behavioral health services here in the county in a very significant and admirable way, we, like we do in Orange County, have been attempting and taking on innovation and transformative work electively. We have been doing that in a very positive and proactive way. And that's what we do. That's Orange County. That's our nature. We've been doing that voluntarily. This change is causing that to happen without the notion of volunteerism and collective innovation. So I think that's what you're calling us to do. And Dr. Kelly, we have to come together because we are forced to now. We are enduring changes to what has been and has developed as a quite productive and quite effective system of mental and behavioral health. But we're forced into that change now. So just an observation as the mental health commissioner on this commission, and we need to be involved and engaged in that. So, and we appreciate Dr. Kelly's leadership.
Thank you for that comment. Seeing no other, I just want to make sure we don't sort of bypass something that was really important. There was some great work done by Dr. Kelly and her team in a couple of offices in lobbying. As bad as this is, it could have been worse. So there were some adjustments made at the front end. So, you know, we obviously know this is going to be a difficult adjustment for all of us to make, but there was some work. And to the extent that there are some relationships that we could leverage. Dr. Galley is somebody who I've known for quite a while, and he is going to be in the sphere and working on this. So we have to also leverage those relationships that we have. Folks that see us as a good actor, right? And if we can compel them and make some, get some support in the legislature again to, sort of finesse around the edges, that's something that I encourage all of us to think about. So in any event, thank you, Dr. Kelly, for that presentation. We'll now move to our action items on today's agenda.
Item number 3 is an action item regarding membership recommendations, including a membership update, and to approve the launch of a recruitment process and establish a new membership ad hoc committee to evaluate and make recommendation for appointment to the hospital representative to the Commission to End Homelessness, and to be submitted to the Board of Supervisors for final approval. And we have no request from the public to speak on this item.
Thank you, Madam Clerk. And this item is broken up into 2 sections. First section is Section A, which is the membership update. I just wanted to update the Commission that the Office of Care Coordination in our office received a letter of resignation on March 29th from Commissioner Christy Cornwall. Commissioner Cornwall transitioned from the Providence Health System to the City of Irvine in March. Unfortunately, her new role as a city representative excludes her from holding the commissioner's seat, which is reserved for a hospital representative. We just want to congratulate her on her change. We will miss her here, miss her leadership, but she certainly helped us along the way here. And the second section, Section B, approves the launch of a new membership ad hoc committee in order to fill that vacant hospital representative seat on the commission. The Office of Care Coordination has provided a timeline for this process. And so if there's any questions or comments on these items, seeing none, I'll entertain a motion.
Second.
We have a motion by Commissioner Wagner, a second by Commissioner Afable. All those in favor?
Aye.
All those opposed? Abstentions? Motion carries. That moves us along to the next item.
Item number 4 is to approve the Commission to End Homelessness minutes from the February 21st, 2024 regular meeting, and we have no request from the public to speak on this item.
Thank you, everybody. I'll entertain a motion on this item.
Move it.
Motion by Commissioner Wagner, a second by Commissioner Marks. All those in favor?
Aye.
Opposed, motion carries. Thank you, that takes care of our action items for today. I'll bring it back to the commissioners for their comments, if there's any members of the commission that wish to comment. Seeing none, I'll go ahead and adjourn this meeting to the next Commission on Homelessness meeting on Wednesday, June 19th at 1 p.m. See you all later. You guys.
Thank you so much.